Dr. Karthik Giridhar, third-year Hematology and Oncology Fellow at Mayo Clinic.
I'm Dr. Manish Kohli. I'm a professor in oncology in the Division of Medical Oncology, Department of Oncology, Mayo Clinic. We're over here to discuss our upcoming article in the Mayo Clinic Proceedings, Management of Muscle-Invasive Urothelial Cancer and the Emerging Role of Immunotherapy in Advanced Urothelial Cancer.
Bladder cancer remains a significant issue in the United States, with an estimated 77,000 new cases that will be diagnosed in 2016. We're excited to talk to you about some of the recent developments, as there's not been a new drug approved by the FDA since cisplatin in 1978, and more recently there's been both an explosion in new treatment options and there's been significant discovery into the molecular pathogenesis of urothelial carcinoma.
So what we have done in this article is to describe the genomic advances that have taken place in urothelial cancer, and we've also set out to describe the role of immunotherapy with the FDA approval or accelerated approvals of multiple new immunotherapeutic agents which are going to impact clinical practice in how we treat this cancer once patients in the advanced settings are becoming refractory to our conventional chemotherapies.
Turning our attention to Figure 1, we can delve into the genomic classification of urothelial carcinomas. Conventionally, we would describe urothelial carcinoma based on both morphology and immunohistochemistry. However, recently we've applied genomic classifiers and used whole genome expression to better identify intrinsic subtypes of bladder cancer. And as you can see in Figure 1, there's numerous classification schemes that are used, but at the broadest level, urothelial carcinomas can be broken down into basal and luminal subtypes, each of which harbor specific genetic alterations and have the specific clinical pathologic phenotypes.
So the cancer cell, what it does as it advances over time, and because of the high mutation rates that are seen in this particular tumor type, there are a bunch of neoantigens which start getting expressed on the cancer cell surface, which are somehow related to also obviating the immune surveillance that the body has to offer. Now, one of the things that happens in this milieu is that the expression of altered mutational antigens, like checkpoint inhibitors, also contributes to this loss of immunosurveillance. And if we were to somehow inhibit these altered neoantigens, we may be able to help the patient's immune surveillance system to attack the cancer as such. And that is what these drugs do. These drugs, these new immunotherapeutic agents, try to re-establish the immune surveillance of the body to attack the cancer cells again.
Of the immunotherapeutic agents, pembrolizumab is the one that has phase 3 data and has received a regulatory FDA approval. The other agents, atezolizumab, nivolumab, avelumab, and durvalumab, all have received FDA accelerated approvals, and the landmark study that led to pembrolizumab approval was KEYNOTE-045, in which patients were treated either with physician's choice chemotherapy versus pembrolizumab. And amongst all these checkpoint inhibitors, typically what we see is a response rate ranging between 15 to 21%. And though while that response rate might be low, of those that do achieve a response, the response is long-lasting, often lasting a year or longer.
So now we are in the slightly more happier position in which we are treating our bladder cancer patients with cancer chemotherapy of the conventional type, and now also adding to that these new immunotherapeutic agents, and people and patients are living a little longer and perhaps with a little better quality of life, which goes down as cancer advances over time. The hope is to build on these in the future, and one of the areas of key interest now is to develop biomarkers in this space towards all of these new and perhaps the older agents that we have used for a long time as well. We hope you'll enjoy reading this article. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.